Good afternoon, everyone. Honorable Minister of Health and Family Welfare of India, Dr. Ghulam Nabi Azad, Honorable Minister of Medical Services, Professor Peter Anyango of Kenya, and Deputy Minister of Ghana for Health, Mr. Robert Joseph Metal-Nunu, distinguished guests, ladies and gentlemen. Welcome to the first global forum on bacterial infections hosted by the Public Health Foundation of India and the Center for Disease Dynamics, Economics and Policy. I am Ramanan Laxminarayan, Vice President for Research at Public Health Foundation of India and Director of CDEP. It is my great pleasure to welcome all of you. It is an honor to host our three distinguished guests, Professor Nyong'o from Kenya, Dr. Metal-Nunu from Ghana, and our very own Minister of Health, Dr. Ghulam Nabi Azad. We also have Dr. David Heyman, Chair of the Health Protection Agency in the United Kingdom and former ADG of the World Health Organization for Communicable Disease. It's our pleasure to welcome all of you. We also welcome the 450 delegates from from 40 countries to our beautiful country, especially those of you here for the first time. And for those of you who've been here before, welcome back. Now, this conference is really the first about antibiotics and treatment for bacterial infections of this size to be held in a developing country anywhere. Now, antibiotics, as you all know, are unlike any drug that we know. We've had them for just over 70 years. And before that, dying of a bacterial infection was a very common occurrence. Now, antibiotics are unusual in that their effectiveness is essentially a natural resource. So if I overuse or misuse antibiotics, that has a consequence for all of you, both in this room and outside. But yet, we don't really treat these drugs with the respect that they deserve. Many of us have seen the data. There's increasing drug resistance, more treatment failures, and there's more lives lost, especially of newborns dying, and also of elderly who are admitted to the hospitals. The problem is worsening at a steady rate. Now, this is a problem that is not just unique to developed or developing countries. It is shared by both developed and developing countries. But what is unusual here is that in the developed countries, because of access to more powerful antibiotics, the problem shows up as increased cost of healthcare. In countries like ours, where many of the people in the population cannot have access to the more expensive drugs, the resulting consequence is longer stay in hospitals if they can afford to go to hospitals, being sicker for longer, or in some instances, dying of the infection that cannot be treated. Excuse me. Now, this is a problem for which there are no quick fixes or magic bullets. The response is really going to require hard work and concerted action by a whole range of players: governments, non-government organizations, clinicians, pharmaceutical companies, health insurance payers, and many others, to make sure that the actions that we all take collectively do not promote antibiotic overuse, but at the same time, we must be mindful of the need to not restrict antibiotic use for the hundreds of thousands of people who don't have access to them. So recognizing the unique value of these life-saving common property drugs and building on the tremendous progress that has been made both by India in formulating an antibiotic use policy for the country, as well as the declaration of the ministers of the Southeast Asia region in Jaipur just a month ago, the Global Antibiotic Resistance Partnership, which has organized this meeting, has issued a New Delhi call to action to preserve the power of antibiotics. And this will be a basis for our own continuing efforts on this area. Specifically, the call for action is to extend access to effective antibiotics to those who would otherwise be ill or die from severe bacterial infections, prevent as many infections as possible through vaccines, infection control, and other proven measures, achieve a balance within our own countries between access to effective antibiotics and interventions to reduce unnecessary use, and finally, to advocate for a global coordinated response supported by national governments, international organizations, academia, and the wider healthcare community, which includes the pharmaceutical industry, sharing information and strategies, having transparent leadership, and to reduce the need for antibiotics and use them effectively when they are needed. This is a huge challenge that lies ahead of us, And I encourage all of you to join us in this call for action, and you have the document of the call for action outside available to you, and some of you probably have it with you right now. In the words of the poet T.S. Eliot, what we call the beginning is often the end. And to make an end is to make a beginning. So the end is where we really start from. This is the end of 3 years of much work by our many colleagues in many countries working to protect the power of antibiotics. And all this is culminating in the work of the Global Forum. So the call to action is really the beginning of a long road that lies ahead of us to ensure that the hundreds of thousands of children and adults who die without effective antibiotics no longer do so, and that future generations can continue to rely on these truly miraculous cures. Now, as I said, this is the first and largest meeting devoted to drug resistance in a developing country, and we are honored to have you here as our guests. Now, it's also fitting that this meeting is being held during the last 3 days of Navratri, which is a very important festival in our country. You probably see, for those of you who are not from India, a lot of people dressed up festively outside. Now, these are important days because these 3 days, which start from today in Navratri, are dedicated to the goddess of learning. And indeed, these are good days for all of us to learn from each other and to work towards a world where effective antibiotics are accessible to everyone who needs them. So again, on behalf of my colleagues at PHFI and CDEP, of the Global Antibiotic Resistance Partnership, and of people in my country who welcome you warmly, I extend my warm welcome to you and wish you a productive meeting and 3 wonderful days in New Delhi. Thank you very much.